Hi, sexy. Thank you so much for joining me today. Again, this is Anti-Aging Sensuality. I'm Dr. Limor, your friendly sex and relationship counselor and therapist. And do you hear the rain coming down on us? I have to admit, I'm not a big fan of the rain and winter and cold, but I do love and fancy the attire. So today's attire are winter boots, and very excited about this. So let's jump right in. Today's question has to do with female libido. The person submitting the question didn't say his name. He submitted something anonymously, but he did say he's a male. So that's relevant because the question is, what happens to female libido? Why is it? Why are there fluctuations? And is there anything that can be done about it? So I want to relate because we're dealing with anti-aging sensuality and we're dealing with the idea of growing wiser and adjusting our body to the new situation. So I want to address the situation for women that has to do with many periods of life, but today I want to relate to the perimenopausal and menopausal period that impacts libido greatly and kind of puts a different kind of approach into the whole sexuality sensuality field. And so we're talking perimenopausal, which comes before menopause. Menopause is signified by 12 months at least of lack of menstrual cycle. And so even before that, like maybe a year or two before, we can experience symptoms of perimenopause that has to do with many symptoms like insomnia, difficulty getting aroused, getting lubricated, hot flashes, a lot of different things that have to do with it. And of course, the libido is impacted by that. So there are many medications, supplements, and therapies that can help with libido. And there are things like maca, zinc, other supplements, ginseng, and a lot of other pharmacological medications as well. But I want to say that two things I want to say. First of all, we are aware that it's a different kind of period of life, but it's not something that we weren't familiarized with before, because after birth, after giving birth, many women postpartum experience something that is a difference between what used to be a very spontaneous desire toward sex or anything sexual, and it turns into something that is responsive desire. In other words, you need to kind of start something going, kind of rolling the dice into the practice of sensuality with intimate touch and other things in order to get the woman motivated to have sex. Because once it starts, the lubrication is more enhanced and the arousal grows. And then we can get into the whole game of sex and sensuality. And this happens again with libido that drops around this period of menopause. So, first of all, we are familiar with these changes of hormonal balance, and yeah, there are many things that we can engage in order to kind of adjust it. And so, first of all, as I said, the first thing I wanted to mention is our familiarity with these hormonal changes. And also I want to say that the mention was regarding women, but men do suffer from kind of a similar situation that has to do with the decline in testosterone and other things. And it's called andropause, which is the synonymous to the female menopause. So men do experience lack of libido and insomnia and pain and difficulty working out and a lot of other things that have to do with also hormonal imbalance and kind of decline in testosterone. So I want to just remove the idea that men are always ready and willing to have sex and women have their own difficulties. It doesn't have to do with gender. Sometimes it has to do with hormones. Sometimes it has to do with life situations. But the main thing that I want to say about this topic is that very much like the rain, and this is why I use this analogy, I want to suggest that we may relate to this period of menopause, perimenopause, andropause, and all these situations and differences in life and changes as just that, as a change towards something new, something that washes the past and welcomes the new, and allows us to kind of relate to our bodies and our situation as something new and exciting, and not like something that we need to reprimand the past or kind of go back to the way we were, because this was perfect and now it isn't. Now is perfect. Whatever we are and wherever we are, and we can do many hormone replacement therapy, supplements, medications, everything. But I want to make sure that your state of mind is suitable for this situation that is now new and different and wonderful. So this is my message to you today. Hopefully this helps you. I'm looking forward to your questions. I cannot wait to see them and answer them. I promise I'll get to all of them. And until then, as always, stay sexy and subscribe, and I'll see you very soon. Bye-bye.